So since we started with the awareness, I think a lot of people are getting to know that they can just walk into any hospital, not even just a psychiatric hospital. You can walk into any facility, though right now we are in a transitional era of where we are moving from the facility or institutionalized management to community based. Even in our communities, we do have units. They go around every time, just that you don't know. Any clinic by you, we do have units in there, whether general hospital or psychiatry. Just walk in there and then demand to see the community psychiatrists or community psychiatric workers over there or units. They will direct you through just for an assessment once a while, just like we would do to any general medical examination, which we do every 3 months. It is advisable to also do your mental state examination. We equally do have a mental state examination, which we call MSC, which is just like our general routine examinations we do for our liver, kidney, and stuff. We also do have it for the brain, which is the mental state examination. You can walk into any facility and undertake that examination anytime. That is for people who want to prevent that kind of disorder. And then those that realize that there is a little issue and they are not so sound, you can also use the same way, come for assessment. If we are able to detect what it is, there is a lot of help we can give you. There is management across every disorder right now for you to be able to fit back into your community. So help is all around you. Right now, we are even avoiding the institutions. So we are coming to the homes. We are coming to your communities. Under your trees, we are there. But we also do have lines available. There are telephone lines available that you can call to any type of consultation you want to go through. Some of us too, personally and privately, do give private service. We do home services. We are also available. If you are ready and you call us, we'll put our numbers there. Now it's an era of telemedicine. So we can just talk to you on phone. It is also available. There's help right now at your doorstep. Either ways, you'll be able to be sorted. That's a very good question. And I think for some time now, we have passed a bill on that. The traditional leaders, the pastors, and all. It's a bill that has been passed. So I think right now they are doing so well. Some of the pastors are even bringing the patient to ask themselves. Some are even scared. They will come and they'll be like, go to the hospital first before you come. I'll say at that part, they are doing so well. Yes, we are still on it. The pastors are doing well now. The traditional based believers too are doing so well right now. Some time back, it used to be a problem. Yes. So we actually passed the bill and then we trained them. Yes, there are trainings going on for them. You don't see that in this part of Ghana because we are in the cities. But when you go, you target the districts, the rural areas, and other places, you realize that when you go to your villages, you realize that there's a lot going on. There are trainings for them, the pastors, and they know the law. They know the law has been passed. So if I don't do it, so whichever pastor you see doing contrary to what we have put across might be hiding it, or the patient going there might be ignorant of what is on the grounds. Okay, but those pastors and traditional believers who have been educated and are adhering to our policies with the mental health authority are doing so well now. They're actually directing their clients back to the hospital before they go and continue with their ancient belief of the cause of the disorder. Normally, they used to chain the people with mental disorders in the homes, the church homes, the traditional sectors and stuff. You formally see them being chained, caned, and all that. There are laws now. When you are caught chaining a patient or beating a patient or anything, you'll be jailed. So now they know that bill has been passed and is there. But just that we are just praying that as we have started the awareness, we will also throw more light on the legal aspects as well, so that everybody knows what the do's and don'ts in the management of a mental disorder. But I think a lot of them are abreast right now and they are cooperating with us. Yeah. As I previously said, mental state examination should be part of your general routine examination, just like you do every 3 months. I don't think there should be a threshold. No, it should be a screening. We are all human. If you are able to see a threshold, then that means you are leading to the disorder or the damage. So I personally would say it should be part of your routine examination. At least every 3 months or 6 months, you can come or go for a mental state examination anywhere close to you to assess yourself, because you can't even tell the threshold of your sanity. You understand where you have gotten to. I'm fed up. Well, you have some symptoms where you feel like you are stressed. That is when you are unable to sleep, you're unable to eat, you are just complaining, you feel like you are talking too much because you are taking care of a lot of babies or children, you are screaming here and there. At each point in life, we all go through that. They are normal events or things you can go through at home. You understand? But when it becomes pushing you into the corner for you not to be of yourself, then you know that you've gotten to the threshold. At least you might have experienced one or two symptoms to know that no, I have to go to the professional to be assessed to know if I'm okay. But I don't think you should wait till that stage of life. It should be part of your routine examination. That is what we are advocating for. It should be part of our, just like our general examination. We go and do for our kidney, liver, and then our blood. Mental state examination should just be part of that your check every time. There's management for every disorder. There might not be the curative management of the disorder that will tell you that it will go and never come again. No. But what we strive at as professionals is that it is treatable and it is manageable. So the management becomes part of your life. Just like you go about taking your diabetic and hypertensive medications, or let's put it this way, your normal supplements you take every morning, or your normal prayer meetings you have every morning. If your disorder just needs a psychotherapy, then it will be your ritual every morning to see your psychologist. This becomes part of your management to protect your sanity. Okay, people will ask, is it curable? No, it is not, but it is treatable and manageable for life. Okay, so we have types of management, which depending on your disorder, you realize that there are some disorders that you just need to talk to a psychologist and your mind is freed. But when it gets to the psychotic part where you become distractive and move into other symptoms or signs that makes you to not to cope with the life's events or daily itineraries, that makes you not to be in the normal personality that you used to have, then we will now add up medications. Okay, that's a chemotherapy. We have medications that we can give you, and then the therapies where we have the psychotherapy, and then the behavioral cognitive therapy, where we try to help you mold your behavior back, because some of the disorders are as a result of a lifestyle disorders. Okay, so those are the two types of treatment we have. And then we also do have follow-ups, which are your reviews. After the treatment, we make sure that we engage you online and also make sure that we talk to you for you to visit us at least a day in a month for us to see how you are faring with your treatment and all that. So these are the various helps we have available at our facilities online and even in the communities that around you. Yes.